Gum disease and tooth decay are caused by plaque bacteria. Plaque bacteria constantly accumulate in our mouths. Plaque can be seen as that soft, white, fluffy coat that forms on our teeth. When you look at your teeth and gums, it appears as if the gum is attached to the tooth right to the very edge, but it's not. There's a collar of gum that surrounds every tooth that is not attached to the tooth. This creates a pocket or a sulcus. Plaque bacteria love to accumulate in this gap, especially in between your teeth. And if you leave plaque bacteria in this gap for 48 hours, the bacteria can mature to such an extent that they start infection. Start your cleaning session by flossing in between all your teeth. It is not difficult. These are very handy. Called floss picks, they are made by Oral-B and sold in a packet of 30. They are disposable and much easier to use than floss on your fingers. Place the floss in between the two teeth. Pull to the one side. Move the floss down as deep as you can in between the tooth and the gum without forcing it. Move forwards and backwards and up and down to dislodge the plaque. Push to the other side and clean in the same way. Take the floss out and move on to the next gap. If the contact between two teeth is very tight, use a sawing motion to get the floss in. Do not be put off by tenderness and bleeding when you start flossing. Tenderness and bleeding are caused by gum infection and will get better as your cleaning improves. Your back teeth are cleaned in exactly the same way as your front teeth. Place the floss in between the two teeth. Pull to the one side. Clean the one surface. Push to the other to clean the other tooth surface. Take out and move on to the next gap. After flossing, use interdental brushes to clean the larger gaps in your mouth. These particular ones are made by a Swedish company called TP. They are sold in a packet of 8 and are reusable. They are color-coded according to size, and they can be bent to make it easier to fit between back teeth. The trick in using them is not to force them, but to find the path of least resistance between two teeth. Push through and then brush 5 or 6 times. They should fit snug. Do not fall into the trap of using too small a TP brush for the gap size because it's easy. It won't clean well. Here you can see a TP brush being pushed through and showing on the tongue side. Once you've cleaned in between all your teeth, you can start brushing. Studies have proven that electric toothbrushes clean much better than manual toothbrushes. The technique is completely different though, and takes some getting used to. We recommend the Oral-B range of electric toothbrushes. To clean well with your electric toothbrush, it is very important that you place the brush head correctly. Stand close to a mirror, in good light, so that you can see exactly where you place the brush head. The principle is that every tooth surface is cleaned for approximately 3 seconds. Start behind the very back tooth. Count slowly to 3 and then move on to the next surface. There is no scrubbing. The brush is doing all the work. Clean all the flat surfaces first, before moving on to the outside surfaces. The brush head is placed with the bristles perpendicular to the long axis of the tooth. The bristles overlap the gum. It won't cause any harm unless you use excessive force. The front teeth are cleaned in exactly the same way. The inside of the mouth is the most difficult to clean. It is essential that you can see what you're doing. Spit out all the foam that the toothpaste creates and stand close enough to the mirror.